It's also, I think, important when we have a lot of stress in our lives to kind of break it down into whether the problem deserves like sort of a solution focused approach or an emotion focused approach. And what it really, I think, breaks down into is whether or not you have an aspect of control. So you can kind of think about, okay, so I have this problem. Insert whatever the problem is. I don't know how I'm going to get my significant other to their chemotherapy treatments for the next week, or, you know, whatever the problem is, and ask yourself, like, can I change it? Do I have some aspect of control over this? Is there something I can do about it? If it's yes, then you sort of work your way down to, is now a good time to work on it? Do I have the resources? Do I have the ability to work on this right now, or am I too exhausted or too tired? If it's a good time, then you move to problem-focused coping, which I will talk about in just a second. If it's a problem that you can't change, maybe it's something that's out of your control, like I am super worried about whether or not this treatment is going to be successful. Okay, so I don't really necessarily have, a caregiver may not have control over that. So if you can't change it, you don't have any control, then you need to, there really is no solution, so you have to cope emotionally, cope with the emotions that come along with it. And so the problem-focused coping is very much focused on, I feel like we learn very early on, and I'm going to skip ahead for just 1 second, to just highlight the steps of problem solving, which seem really simple. I think everybody knows like the steps to problem solving, but I think in the moment of stress, you can lose track of this really quickly. So if you're you have a problem and it's something that you can solve and that you can work through these steps. So really define the problem, brainstorm as many solutions. I don't care how crazy the solution is, brainstorm every single solution, ask other people what their solutions might be, weigh all the alternatives, weigh the pros and cons of each solution to help you select the best alternative, and then do it and see how it goes. Monitor the progress. If it's not going well, go back to all those things that you brainstormed, try another one, kind of work through it again as many times as you need to. Looking at this, I'm like, yes, of course, we all know how to do this. This seems really simple. But I think when things are really, really stressful, it's easy to get caught up in like step one, like just getting caught up on what the problem is and never moving forward to like what I can do about it or what I can change, or getting caught up in like I could do this, or 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 this, or this, and never actually breaking it down into, okay, what am I actually going to choose? So it's important to keep these steps in mind, even though they seem pretty simple. So problem-focused coping, if you have some problem that you actually can have some control over and you can change, use that problem-solving approach, get organized, manage your time, get some support, use assertive communication, whatever you need to do. Basically, if you have a problem, there's something you can do about it, do it, act. If you have a problem, can't change it, nothing you can do about it, out of your control, then it's more a matter of coping with whatever the emotion is. So then you're going to be doing more emotion-focused coping. And that might be short-term things like distracting by, maybe it's going out and taking a walk, or trying to get to, a yoga class or a movie on the weekend, talking with a friend, doing some of those relaxation techniques I talked about. Mindfulness can be an important aspect. I feel like mindfulness is becoming very popular these days. Mindfulness is all about being in the present, being focused on the here and the now. It's really, really easy to get caught up in what's to come, what if this, what if that. Very easy to get caught up in shoulda did that, shoulda done this, oh my goodness. And so we end up missing like what's most important, which is right here, right now. So mindfulness is really important, and breathing is a great way to practice mindfulness, and the reason is because the breath is always happening. So if you take a second to just check in with your breath, follow your breath, count your breaths, you're being mindful because you're paying attention to what's happening in the here and the now. We take something like 10,000 breaths a day, and how many of them are we actually aware of? probably not very many of them. So when people say breathing, deep breathing, it's really important. Like, it is actually really, really important. Something like deep breathing can bring your stress down. It can help you practice mindfulness. It can be hugely, hugely important. I've seen people like bring their blood pressure down just by taking 30 seconds to do some deep breathing. So it can have a very important impact. And of course, obtaining emotional support in whatever way you need to do that. So we've kind of covered that one. So let's talk just for a few minutes about just some really, really basic ways to improve sleep. Sleep seems like it's something that gets really thrown off very easily and very often. And some really key things are to try to keep a regular sleep schedule. I know that's really a tough thing for most people, but trying to have a bedtime that stays the same and a waking time that stays the same. Even on the weekends. I know a lot of people are like, but I like to stay up late on the weekends and then sleep in. Try to keep it as close to the same time, going to bed and getting up as possible. Using your bed only for sleeping and sex. That's the only exception besides sleeping. So no computer I can't say that I practice all these things myself, but if you are a sleep sensitive person, like you feel like you really struggle with your sleep and falling asleep, then do not use your bed for working, reading, watching TV. Your bed should just be a place where you sleep. Get out of bed if you cannot sleep. And the reason is the more time you spend in your bed not sleeping, the more your brain starts to associate your bed with a place where you don't sleep. So if you're not sleeping, get up so that only time in bed is spent sleeping. And the rule is about 15 minutes. So if you've been laying there 15, 20 minutes, get up till you feel tired again, do something mundane, I don't know, read a magazine or a newspaper, and then try to go back to sleep when you feel tired enough. If you still can't fall asleep, get back out of bed and do it all over again. It sounds really annoying and irritating, but it works. Adjust your dietary habits before bed. So if you happen to be a smoker, cut that last cigarette out before you go to sleep, because that can have a huge impact on keeping you awake. Cut out caffeine, obviously. Eating a big, huge meal before you go to bed, probably not a great idea. Your stomach's going to be upset. Do what you need to do from a dietary standpoint to help with sleep. Try to break the worry cycle. I feel like when we put our heads down, that can be a prime time for when the thoughts get going and things get overwhelming pretty quickly. So whatever you need to do to break that worry cycle. Some people, they like to journal or write a few things down before they go to bed, or sometimes I will prescribe a worry hour, which is, it doesn't necessarily have to be an hour. It could be a worry 5 or 10 minutes. Just sit, write down every single thing that you're worried about. It could be anything and everything, and just write it down, get it all out, and you've sort of done your worrying. You've done your due duty, you've worried about it, you've written it down, put it aside. Sometimes just doing something active with what's going on in your brain can actually help quiet it down a little bit. Some people toss that piece of paper, some people burn it, some people hang on to them, and it can actually be kind of telling if you look back on it 6 months later, like, wow, that was all the stuff that I was worrying about, and wow, none of that came to fruition, or some of it did, or I ended up coping with that really well. Like, it's kind of interesting to see the things that you worry about and how that progresses or how that changes. Winding down, having a bedtime routine, whatever that is. Some people take a shower before they go to bed, some people read for a while, watch TV, whatever you need to do to kind of wind down and decrease screen time. So it's really important to have the TV off, have your phone off, nothing bright, telling the brain time to be awake. Cutting all that stuff out when you're trying to go to sleep is important. So this skill is a very specific skill for tolerating a stressful moment. So this is more of a short-term stress management skill. This is not something that's going to solve, all the world's problems or anything like that. But this is more for when you're having that moment of like, oh my gosh, I just cannot go any further. I am just at my wit's end. I'm about to lose it. I can't get through this moment. what do you do? So improve the moment is the name of the skill, and improve stands for, it's an acronym. So each part of the skill is represented by the word improve. So when you're having a stressful moment, try to improve the moment. So the I stands for imagery. So the example I have on here is sometimes people find it helpful to, if they're overwhelmed with their thoughts, to kind of imagine their thoughts on clouds. So imagine like laying on a beach or in the grass or whatever the case may be, a calming place, and just kind of putting your thoughts on clouds and watching them kind of float by. Doing something to bring an image to mind, and sort of remembering that, your thoughts, you can have them. You don't necessarily have to get rid of them, but you can also sort of let them go. And remember that in the background is the sky, and that can be you, that you don't necessarily have to become your thoughts. You don't necessarily have to be completely overwhelmed by your emotions. You can sometimes get a little bit of separation, and sometimes using imagery helps with that. Imagery is also, you can use any kind of imagery, whether that's, pulling to mind an awesome vacation spot you've been in, or maybe if you just imagine yourself like sitting on your back deck with a cup of coffee, because that's the image that brings like calm or relaxation. Whatever that image is, bring it to mind. We know that when you bring those images to mind, we activate the same parts of the brain that are activated when you're actually in that spot. So if you can bring a really vivid image to mind, that can really help bring stress down. The M in improve the moment stands for meaning. So meaning making can be really, really important when we are feeling like we are just doing everything we can and it's not appreciated and it just feels like it's never enough. Finding a silver lining. Is there something about this super stressful, terrible situation that means something, is worth something, and trying to really hone in on that. An example is, I had a patient who shared with me that he was diagnosed with cancer, and it really connected him back with his like spiritual and religious beliefs, and he felt like that was hugely meaningful. Now, nobody wants to get cancer to be connected spiritually, but if there is a way that you can find even an ounce of meaning within stress, within a terrible situation, that can be helpful in just taking the sting out of it a little bit, knowing that, okay, this is maybe happening for, not necessarily happening for a reason, but there's something about this process that I can find some meaning in or some purpose. There is a whole therapy actually designed around meaning making. It's called logotherapy. A lot of people are familiar with the book Man's Search for Meaning. It's by Viktor Frankl. It's a psychiatrist that went through the Holocaust and lost his whole family in the Holocaust. So, just the worst of worst situations. And he felt that he came through that by finding meaning, by meaning making. And this psychiatrist developed a whole therapy around finding meaning in sort of awful, terrible situations. So if you can find a silver lining, try to find it. So the P in improve the moment stands for prayer. The serenity prayer is a good one. People really like that prayer a lot. And if you're not religious, not a spiritual person, it doesn't necessarily have to be that kind of prayer. It can be non-traditional prayer, just taking a moment to kind of quiet down, process your thoughts, whatever, meditation, whatever the case may be. Just taking a few minutes for yourself. The R in improve the moment is for relaxation. We talked about a lot of different ways that you can do that. Whatever you do to relax, do that. Try to get some time in to do that. Mindfulness is also important. So the O is for doing one thing in the moment, finding a way to practice some mindfulness, practice being present, practice being in the here and now, whether that's with your breathing, whether that's walking from work to your car, paying attention instead of on your walk from work to your car thinking about, what do I have to do when I get home? What am I going to make for dinner? What are the kids going to be doing? What do I have to do tomorrow? What's on my agenda? Just walking to the car and paying attention to what you can see, what you can hear, paying attention to the weather, your footsteps as you go, your breath as you walk, and just finding those few moments to be present and trying to not let your brain get way ahead of you or fall back into stuff that's already happened. Finding ways to be present and be mindful can be hugely helpful and important. And there are always, mindfulness can be a very structured approach. Like there are lots of books, lots of workshops, lots of ways to practice mindfulness through meditation and through all these different techniques. But you can really practice mindfulness anytime, anywhere. It doesn't necessarily have to be, I need to find an hour to sit somewhere and practice mindfulness. It can be 2 minutes, however you want to do that. So the V in Improve the Moment stands for vacation. So this is that whatever you can do to find just a few minutes for yourself. That might be 5 minutes with the bathroom door locked where nobody's talking to you and nobody's finding you. Go to your bedroom, pull the covers up over your head, and just take like a time out. It can be a vacation too. Like that's great too. We can't all, I wish we could all just like hop on a plane and go to Hawaii for a week, and I'm sure everybody's stress would be way reduced, but we can't all do that. So if you can do that, great. Get away for a weekend, get away for a day, half day, go to the spa, whatever you need to do. 2 minutes, 5 minutes, a weekend, a week. Find time to get a break from the stress, to get a break from things. It's really, really, really important. And if you can find a time a day or find a way to incorporate it into your routine, that's hugely important. So if you know that, okay, before I go to bed, I have 5 minutes where things are quiet, and that's just time for myself. Or I know on my way home from work when I'm in the car, like I'm turning my phone off, I'm not listening to the radio, I'm just gonna drive home, clear my mind, and have this few minutes to myself, like whatever you need to do to get a break. And the last letter in Improve is E, and that stands for encouragement. So this is just a reminder that sometimes we need to be kind of our own cheerleaders and encourage ourselves and remind ourselves that as caregivers, what we do is really, really important. I think social support and caregiving is a challenging role, but a valued role, and something that is so, so important. So know that what you do matters and counts and is incredibly, incredibly important. So give yourself a pat on the back once in a while, more than a pat on the back. Like you should have a gold medal or something. So improve the moment, just some general things you can do when you're stressed out and you need to just get it together for just a few minutes. These things can be helpful. So the last thing before taking questions that anybody has these are just some resources as far as finding treatment or looking into some of these things that we've talked about today. So if you are looking for some additional support from like a counselor or something like that, EAP or employee assistance programs are great for that. The Ohio Psychological Association has a bunch of information as far as mha.ohio.gov, which has all the community mental health centers. So these are a few websites where you can pretty readily find a counselor, a psychologist, a psychiatrist, if you're looking for some additional support. The therapists at psychologytoday.com goes as far as like what type of insurance people take, what kind of hours they have, what kind of specialty areas different counselors have. So I really like that website a lot because you can really get a lot of details. So those are just some options for finding folks who could be helpful. Obviously here at the James, we have James Care for Life, which puts on tons of programming and so many great things that are happening with the James. They put out their quarterly brochure. You can access the information online. The YMCA and a lot of local health centers often have classes in relaxation or mindfulness or meditation. So keep your eyes open. There are a lot of things that are going on in the community that I think sometimes we miss, or things that are going on here that just that just get missed, but there is stuff out there. And then the last link is to an online stress management workshop that you can kind of do and work from home. And also, I talk a lot about Immerman Angels, which is a national like peer support program. So what they do is they connect caregivers to other caregivers, or cancer patients to other cancer patients, with a similar diagnosis, similar background, to pair up people so they can support one another. So you can either sign up to be a mentor or to be a supporter, or you can sign up to get support, and it's, you know, one-to-one, and it's it could be someone that's like anywhere in the country. So a lot of it is like phone, email, Skype type of support. You're not necessarily going to get someone who's like down the street that you can go to coffee with, but they actually do a really good job of matching you up with somebody who has been through something similar, so they'll have a pretty good understanding of what you're going through, and you'll be able to at least connect on some level and gain some support. Or if you feel like you've gone through this process and you have a lot to offer, which a lot of caregivers do, don't hesitate to sign up to be a mentor yourself. Like, you guys have great information and a wealth of knowledge, and you could be so supportive for somebody else. So sometimes it feels nice to do something nice for somebody else as well. So that's another option.